We're having a great conversation here, Matt. Thank you, Matt. We got to talk more about it. That's about next week's program on the Holy Ghost or the spiritual.
That's a fantastic topic. I can't wait to see it.
I'm really excited about it.
Yeah.
Hello and welcome to On Call with Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show. So let's get started. We've got a bunch of questions, and thank you for these questions. Is there a depression peer support group similar to AA and Brookings or in other communities, Matt?
Yeah, I do not know of a public group, particularly one like AA, which is national, and you can find it in virtually every community of any size. I do not know of that. I would say that your doc, there are counselors in town. There are a few group opportunities, but there really isn't, to my knowledge, a really consistent peer-to-peer support group out there.
NAMI has been.
NAMI's a wonderful organization and really kind of fighting the fight we were talking about earlier during the program of reducing stigma and advocating for rights for those with mental illness.
I would encourage, if you can find a NAMI group.
I will say 211 is more than just a helpline. They're also aware of organizations, groups, and things, so they may be a resource you could tap into.
Oh, all right. From email, can you please talk about postpartum depression? Are there some natural remedies to try? That's a real deal. I've seen people really hammered by depression out of the blue once they have their baby.
It is an absolutely real illness, and it is related to the hormonal imbalance and trying to get your body back into the right frame of mind. We talked during the show about the fact that perception can change during illness, and I've seen some of the most striking evidence of that during postpartum depression. And I can tell you that I've had mothers who were concerned they were going to harm their child because they just had these obsessive thoughts that they were going to harm their child. The last thing they ever wanted to do was harm their child, but they couldn't get the thoughts out of their head, and they were afraid that those thoughts would influence their behavior. It speaks to the power of the illness and how it can take over your mind and make you think things and believe things that just don't line up with your reality.
So get help.
Get help, and in terms of natural, one of the real keys is trying to reestablish that proper hormonal balance. Antidepressants have been incredibly effective. I'm not sure that there's anything more natural than some hormonal replacement, but
I like exercise. I like light. Yeah. Those are non-medicinal therapies, but they're not often enough.
Yeah, I think they're contributive, but not curative, and they are very good things for almost anything that ails us, but you're probably going to need more, and this is where I would definitely seek professional help. And honestly, your OBGYN they're well aware of this illness, but you may end up seeing a psychiatric specialist.
A West River caller asks, how does one go about healing with lifelong trauma when medication and therapy isn't working, have no family to support you? But there's this post-traumatic stress syndrome. There's also societal post-traumatic stress, like what happens with the American Indian groups.
Historical trauma and things.
But historical trauma. But let's talk about lifelong trauma. And medical therapies fail.
Yeah, so medical therapy
ECT?
probably often is inadequate in trauma-related cases. ECT might be an option if the depression has become a really core component of what you're struggling with, but not everyone who has severe trauma wouldn't necessarily respond to ECT.
ECT is what again?
Electroconvulsive therapy, so that's the shock therapy. Better focused on severe depression, which can be a result of many things, including a history of trauma or lifelong trauma. There are, I would say, differences in talk therapy, so I wouldn't give up on therapy entirely. There are some specific treatments for it. EMDR, which is the rapid eye movement, I am not trained in that. I've been a little bit on the fence about how effective it is, but I know the American Psychological Association believes that there's effectiveness there. So there are other options. I do think you need to continue to look for someone who really specializes in trauma care.
Induced.
It is very difficult. Post-traumatic stress, as an example, there isn't a single drug I would point to that's curative. I often, in my practice, would end up treating the symptoms more so than feeling like I'm going to be able to really treat the trauma directly.
To make a person forget about the severe trauma, that's disgusting, isn't it?
It's exceedingly difficult.
How about from email? Everyone gets down or sad, and people will say they're depressed. There must be a difference between being down and sad or depression. What are the differences?
Yeah, so that's an excellent point. So one of the things that we would define any mental illness, because we all have components of mental illness every day.
Everybody gets sad periodically.
Yeah, and we all have days where our anxiety's higher or not, but that doesn't mean we're diagnosed with anxiety on that day, right? Or we have a little bit of a panicky feeling, but that doesn't mean we actually have panic disorder on that day. So one of the things that we that helps us discern between a few symptoms or a feeling versus a state, does it impact your function, your ability to continue to function? So that's one of the ways we would define it. So when you get truly ill, your ability to continue functioning at a normal capacity will be affected. There's also some degree in there to account for severity. So with true major depression, you will see changes in sleep, changes in appetite, often changes in weight, inability to concentrate, loss of energy. So all those can occur to a smaller degree, maybe day to day. We all have our poor nights of sleep, our days of poor energy, but this is a more consistent and more severe level of symptoms. But if I had to point to one thing, I would say look at that inability to function, and certainly when you add in a symptom of thoughts of suicidality, end of life, that's a differentiator as well.
Right. Very important. I keep thinking of the song, get out of this, what side of the bed, the sunny side of life, and dancing through the beautiful day, and everything's so happy, and life is not that way. I mean, people.
No, and I think for us to kind of expect life to live up to that expectation, we're going to be disappointed. So.
Can you remember the song, and would you sing a few verses?
I won't abuse your audience by doing that in any way, shape, or form.
How about mental illness or depression inherited from genes from our parents?
It does have a powerful genetic component, and we do see it run through families, just like we see most illnesses have a fairly significant genetic component. So we see it in depression, we see it in schizophrenia, bipolar disorder, anxiety disorders, and alcoholism or other substance abuse disorders. It's there, it's real, for better or worse, we're given good genes and bad genes. We can kind of look at our entire life and realize
it'd be nice to be alive and perfect, but we're alive.
Yeah, everything we are is somewhat been determined by those whose progeny we are. So it doesn't mean, however, that we are destined to succumb to those illnesses. It does mean more than likely we're at a higher risk for them.
Yeah.
So an awareness of your family history is important. At the same time, you can't let that discourage you or believe that you're
predestined to be it.
Exactly.
You're not.
There isn't predestiny. We need to do everything we can to be self-determinate.
Make our choices and take them and be responsible and try to do as good as you can with your choices.
Yeah. Acknowledge when we need help and seek help and accept that we're not perfect and never will be in whether it's my health, mental, physical, or otherwise. I will need help at times, and that's okay.
That's right. This is a very good question. How often are antipsychotics prescribed on top of antidepressants to help people who are severely depressed? It's a really good question. An antipsychotic
yeah.
is more like the old Thorazine and all of the major tranquilizers, and the antidepressants are the SSRIs like
Prozac, Zoloft,
yeah,
sertraline,
Zoloft.
or fluoxetine for their. So there are antipsychotics that are FDA approved to augment antidepressant treatment, and you'll actually see a few commercials that will indicate that. I would say they're fairly common because it's a pretty well established augmentation. I think it should be done thoughtfully with a physician who knows what he's doing, because every medication you add has its own set of side effects. Antipsychotics, of course, have effects on such long-term kind of health risks as weight gain and diabetes. So, the problem is, boy, it's always, everything we do in medicine and much of life is risk-benefit weighing, and that's sometimes a moving target itself.
Yes,
so
it is.
Difficult equations, but it's not uncommon.
And if you were going to say one drug that you would consider, and would you consider it short-term until they're kind of back in track and then back away on the major tranquilizer, what drug would that be? Abilify?
Abilify is very common, yeah. So probably has as good research out there for augmentation scheme if you're talking about antipsychotics.
Okay. Comment. Lady has had depression since she can remember and wanted to make a couple comments. One, growing up, she was outwardly blamed for her depression. I thought that's a pity.
Yeah.
Number two, when she was in a phase of depression, she found it was hard to remember that the depression would lift. What's your comment on that? One, blame. Two,
Yeah, the first part of that, the blame, I think it's unfortunately not that uncommon. And my parents were pretty supportive of everything I did growing up. I just feel for the fact that not everyone was fortunate to be raised that way.
No.
Right? So I think that that trauma is, as we talked about just a few minutes earlier, it's very hard to rid that from impacting your life going forward. So I wish you luck with that, and counseling may be successful. The second part of that question was about
not being able to believe that it would ever lift.
Yeah, and I think, again, that's we've talked about it in several different ways throughout the show and the After Hours show here, that depression has this insidious ability to counter your perception of self and your environment and your reality. And depression does that. It makes you feel like you're horrible or hopeless or things aren't going to get better. It is one of the few illnesses that turns you against yourself. I think just an awareness of that is the best you can do, and realize, when I'm depressed and I am feeling this way, it's not the reality. And I have to, if I can't recall the reality, I have to at least recall that every time I'm depressed, I believe things are worse than they actually are.
Yeah. Wow. Do pharmacogenomic testing and tests help determine which medications may work the best for depression and suicide?
That's exactly what they're better for, is determine which medications will be effective for you. Because the best role of pharmacogenomics in psychiatry at this point is to know whether or not you will metabolize a drug effectively and efficiently. So they're not quite to the level where I can do pharmacogenomic testing on you and determine that A, you have a certain illness, and B, this is the perfect drug for it. We're not there. I am sure we will get there. I think this is a very promising area of medicine. What pharmacogenomics will do for me right now, however, is they will look at your liver and the specifics of your metabolism system, the cytochrome system, and it will tell me if you have, and we all have, specific deficiencies, or we're all different. So it will give me insight into which drugs may or may not be tolerated well by your body.
So, my last question is there some thought or some comment you would want to leave with the people at the end here?
Yeah, we've had a wonderful conversation both in the show and the After Hours. I would say one of the strongest things is understand that this is an illness. that our perception, and those that we know that have mental illness, our perception has changed. And maybe most importantly in regard to suicide is if someone you know tells you they're having suicidal thoughts, or even if you suspect it, don't be afraid to ask the question. Support them with compassion and seek professional help.
All right. And I will take that as the very best advice, and I appreciate so much you being here, Matt. This is wonderful. Thank you for giving to our community.
I appreciate the opportunity. Thank you.
Thank you for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. Please visit us at prairiedoc.org for more medical information. Until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.